and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Regarding the next exam for 2020 MBBS batch, Health Ministry forms committee to examine preparedness of medical colleges. In a new development on the national exit test, the Health Ministry has constituted a 7-member committee to look into the preparedness of states and medical colleges for the implementation of the exam for final year MBBS students of the 2020 batch. According to the reports, the Health Ministry said in an order issued on Tuesday, it has been decided to constitute a committee with approval of the Ministry of Health and Family Welfare Mansoor Mandviya to examine the implementation and preparedness for NEXT. The committee will examine the relevant regulations to understand changes proposed under NEXT from the existing system. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. Indian Pharmacopoeia Commission flags ADR linked to GERD drug Esomeprazole. The IPC, through its recently issued drug safety alert for the month of September, has revealed that Esomeprazole, indicated for the treatment of gastroesophageal reflux disease, is linked with adverse drug reactions named hyperprolactinemia. In connection to the above, IPC has cautioned healthcare professionals to diligently monitor the potential occurrence of ADRs when administering the medicine. This came after a preliminary analysis of ADRs from the Pharmacovigilance Program of India database. Esomeprazole is a proton pump inhibitor used to treat GERD, reduce the risk of NSAID-associated gastric ulcers, eradicate H. pylori, and treat conditions causing gastric acid hypersecretion. Roche Diagnostics names Rishubh Gupta as MD for India. Roche Diagnostics India has announced the appointment of Rishubh Gupta as its new managing director for India and neighbouring markets. In this role, he will be responsible for overseeing the company's operations, strategy and growth initiatives in India, Bangladesh, Bhutan, Nepal and Sri Lanka. CDC proposes common antibiotic as morning after drug against STIs. The US Centers for Disease Control and Prevention is preparing to suggest the use of a potent antibiotic for preventing sexually transmitted infections. The CDC recently released preliminary guidelines advising healthcare professionals to consider prescribing doxycycline as a preventive measure against the spread of these infections. This approach, known as doxy-PEP, short for doxycycline post-exposure, suggests taking the antibiotic following a potential exposure to an STI rather than waiting until a disease is diagnosed. If these initial recommendations are accepted, doxy-PEP would be recommended for individuals other than gay and bisexual men, including men who have sexual relations with men and transgender women, provided they have previously been diagnosed with at least one STI caused by bacteria within the past year. These infections include gonorrhea, chlamydia, or syphilis. The CDC is expected to advise healthcare providers to consider prescribing a 200 mg dose of doxycycline within 72 hours following sexual intercourse for these specific groups. However, the CDC requires further data before extending these recommendations to other populations. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.